UC San Diego IT Services and UC San Diego Health Information Services are proud to be recognized with a 2020 Larry L. Sautter Golden Award for technical contributions to the UC San Diego Return to Learn program. Let's learn more about the Return to Learn program from Dr. Natasha Martin.
The UC San Diego Return to Learn program is an effort to test all students, faculty, and staff in the UC San Diego community for the novel coronavirus which causes COVID-19. The effort begins this summer, where we will test approximately 5,000 resident students, and the plan is to expand this in September, where we'll test the entire UC San Diego community every month.
The Phase 1 pilot was conducted from May 11th to May 29th and focused on COVID-19 testing of resident undergraduate and graduate students. Multiple testing sites were set up across campus. The goal of the pilot was to conceive and implement a way for students to self-administer COVID-19 tests, get results back within 24 to 48 hours, and use the findings to scale the process to test tens of thousands of faculty, students, and staff come fall quarter. After the pilot, many of the key individuals joined our Palooza Tuesday webinar series to discuss how they made it happen. Up first, you'll hear about adapting the UC San Diego mobile app with barcode scanning technology to match test kits with students.
Knowing we had a pretty relatively high adoption rate of the UC San Diego mobile app, we thought, what if we could pre-label the test kits with a unique code and then embed the scanning technology into the UCSD app that the students, predominantly already had installed on their mobile devices. Then if the students are logged into the app, we know who they are, and then the QR scanner could be used to associate the student with that test kit. So beginning over the weekend of April 25th, Alex Wu and a few others on my team began the development. It was really hackathon style, had all hands on deck really to contribute to the code base there. And in just a few days, we had a working prototype, and we just kept refining from there.
Eventually, test kits arrive at the lab, and test kit data needs to be transferred to the lab software. A key breakthrough was to automate a manual process.
So what we did was we developed an iPad app that was installed at the lab. The lab used that iPad app as kind of a reader, right? So as the students scanned a QR code on a test kit, that test kit made it back to the lab. The lab then would scan that test kit with the iPad, and it would pull up information about the student. And at the outset, the technicians saw that the patient info on the iPad had to be manually then input into the lab software. So we came up with the idea to translate that test order number that was associated with that particular student into a barcode. And we just did that on the fly. And this was a process improvement suggestion that we made, late one evening, and had that really available in the next day or so.
Keep in mind, the scanning function in our mobile app is new technology. It's always risky to introduce new technology into workflows if they haven't been sufficiently tested. Let's learn more about how we virtualized technical support for students.
So one of the things we did, as you mentioned, from an IT support side, was we deployed laptops at each of the different testing sites, running a continuous Zoom session. So if students had any type of IT issue with the app or their phone, they could walk up to the computer and then we'd be able to troubleshoot with them remotely.
Another component is to capture all test results and notify students.
So one of the fortunate things was actually in the last fall, we were able to bring student health live on Epic, and actually a nod to the UCSD Health IT and the student health team for being the first UC campus to bring student health live on Epic. And as part of that project, we had to load every single student into Epic. And where that benefited us in this project is that we did not need to register anybody. Every student was already pre-registered. So that helped cut down one step there. The next thing is we also decided we were not really billing for these labs to the students, so therefore we didn't have to schedule the students. Another step we're able to take out of the process. And then as for the order, what we ended up using in Epic is a tool called bulk ordering. So instead of placing 5,000 individual orders and someone would just get carpal tunnel, right? We essentially teed up and placed all 5,000 orders in a span of like 20, 30 minutes. And what we did for that is we got a list from housing to identify all students that were still on campus housing students. We added them to what's called a patient list in Epic to kind of give us the population. And then we use that list as our order base. So we place an order for all those students.
Conceiving and effectuating this pilot didn't just happen.
At UCSD, we've done a tremendous amount of Lean Six Sigma, continuous improvement type of training. We've had thousands of people with yellow belts and hundreds with green belts and black belts. And so we're used to thinking that using those skill sets to solve problems.
During the 3-week pilot, 1,578 tests were self-administered. 0 came back positive for COVID-19. As we speak, campus administrators are applying learnings from the pilot to apply going forward. If you want the latest news on the Return to Learn program, visit returntolearn.ucsd.edu.